Here we go. She even greets me at the door.
Come on in.
All right, here we go. This is my grand tour of Sketch Physical Therapy and Total Wellness.
Stretch.
Oh, sorry,
Therapy.
Stretch. Oh my
Stretch.
gosh. Sorry, I need to stretch my mind. So,
Right.
anyhow, and you are
I'm Kim Nartker. I'm the owner and founder of Stretch Physical Therapy and Total Wellness.
awesome. And then all these people up here are.
Those are graduates that have come through our therapy portion and have graduated and now have no pain. And I have a stack of those in the other room and then another stack. We haven't been able to keep up with the overwhelming response of people graduating and getting better.
So testimonials.
These are testimonies. They're personal stories that they've written themselves, and we type them up and then take a picture. Everyone who graduates, we take a selfie with them
Okay.
to show what they've done and what they've achieved.
Awesome.
And then we hang it on the wall.
I bet you
Like
have
for other
some.
patients.
I bet you have some amazing tales.
We have pretty darn amazing things.
Awesome. Awesome. Well, show me the rest of this place. So we.
Okay.
This is your administrative side of things up here.
Yep, this is our reception area
Uh-huh.
here. Come on back. We have a couple different areas. So in here we have a fitness room where we also do our workshops.
Okay.
We host workshops 1 to 2 a month. We've got one coming up tonight on back pain and sciatica.
Okay.
And we also host a Qigong yoga class and a Pilates class in here.
Very nice. Okay.
Back here is where the magic happens. This is where the manual therapy is performed, and then right after people do manual therapy that's focused on grade 4 and grade 5 mobilizations, then we have them stabilize the area that we've worked on.
Okay.
So they go from manually moving the joints
Okay.
to get the mobility right into strengthening and stabilizing that area that we worked on.
Okay.
Okay, that's how we get our success.
Now, how is that in comparison to maybe some of the other people that are doing what you're doing?
So most physical therapists in the area are going to focus on exercise alone.
Okay.
We don't. We go in and fix and find the right, so we want to find the root cause of the problem. We test the person every time they come in, then we treat them, then we retest to show them that they've had more motion. And then right after they've seen a gain in motion, then we're going to stabilize that area so that they keep it.
Okay.
We give them exercises specific to the joints that we've moved so that they can have homework when they come back. They're doing better and we gain more motion.
Okay.
In our 3 phases of care, we go through that, then we stabilize everything
Okay.
so that they can get to do tasks that they weren't able to do, like going up and down stairs, getting out of the car without pain, sitting for longer periods, bending over, standing up tall, turning and looking behind, playing with their grandkids, running, walking, CrossFit, things like that.
Okay.
We get things moving, we get things stabilized, and then we take them into a maintenance. We teach them how to keep it for long periods of time, and if they can't keep everything, then they can come back in here for what we call a tune-up.
A tune-up. I like that.
A tune-up.
I guess everybody needs a tune-up every once in a while.
Yes, they do.
Yes, especially with all the things we end up doing to ourselves on a daily basis.
Right.
So even just sitting, I hear that just sitting, and of course, some of the chairs that we sit in are not the best.
Well, this is where I differ from everybody else. It's not what you're sitting on, it's your body and what's going on in your body. So you've got to look at, if you have pain when you're sitting, it's because your body is telling you something is wrong.
Okay.
And you need to fix it. So it's typically a back problem or a hip problem.
Okay.
Okay? Those things are tightening up when you're sitting because there's a joint compressive force. We're always where we're walking and putting a force on our lumbar spine and thoracic spine. And when we go to sit down, we're putting a bigger force on it. And that joint force and poor posture is overstraining the muscles.
Okay.
Okay? So doing those types of activities over time, when you have degeneration and lock up and arthritis, things aren't moving right. When you go to do an activity like turn or step or run,
Okay.
then something that's not moving gets caught, shuts off those muscles, locks down,
Okay.
and you don't have the mobility that you need. And it doesn't unlock until you go in there and manually unlock it.
Gotcha. So beginning, so if I was to come and to work with you, so what's the starting, like, step one? I mean, paperwork, I'm guessing you're asking several questions, and then how are you guys getting to the root problem? Because I know that do things much more holistically than I guess a lot of your competitors, people out there that are doing the same type of, you know, physical therapy.
Yeah, that's a great question. Everyone that calls us, the first thing we're going to do is ask them several questions. We first want to determine if we are a good fit for them and if we are going to meet and exceed their expectation. So we're asking them what their goal is of treatment and what they're looking to receive for coming in to see us. If they do not fit in the care that we provide, we're going to refer them out to another therapy clinic, because we're going to focus on the type of person who wants to move better, live better without pain, and has buy-in to be able to fix the problems that they have. I'm looking to make sure I have a specialist that can treat them and perform the techniques and meet their expectations.
Sure, because I know some people, they want to like click an easy button.
Right.
And so I'm assuming those are probably not the best fit, since, you know, in order to get to the root problem, not only that, but some things take longer than others.
And it's not really that. It's more on your, we try to get you to your max potential without medications, injections, and surgeries.
Oh,
So
yeah.
it's the client that wants to avoid medication, wants to avoid injections, and wants to avoid surgeries that we're looking. So if they're coming in here and they want to get a prescription from their doctor, or they want to stay on pain medications, or the only reason they're coming into therapy is to get their next dose of medication, or to get an injection and follow just the doctor's orders, our client comes in because they want to be here and they don't want to go that route. So we're your holistic route where we fix it without medications, injections, and surgery.
Sure.
The other route is you just go take a pill.
Right, which
Right.
only
Which is
masks the
not-
problem.
Exactly. We're not fixing it. So we're looking for the root cause and we're looking to fix it. So it doesn't happen overnight. But right now for lumbar stenosis, we're about 10 visits.
Oh, wow.
I mean, when we started the back program, it took us about 18 to 20 visits. Now about 10 visits is our median. 6 to 10 is our median.
So then I guess that would ask the question is that you guys must be learning techniques and doing things a little bit differently, and maybe some newer things that are coming out that are allowing you to get people to get through the process a little bit faster, but it's efficient and still effective.
Correct.
Awesome.
Yeah. So you're coming to us for life. You're going to come to us for that 10 visits. And depending on the level of it, the last person that we saw that was 10 visits, he was about a 20-year chronic stenosis. He came in about here and he couldn't stand up. It took him 10 visits to get better. He just discharged yesterday.
Now, explain, what's stenosis? I'm pretty ignorant to some of this stuff, so
Okay.
hit
So
me.
there are 3 common causes of back pain and sciatica. The first is a herniated disc.
Okay,
A herniated disc is someone who has pain when they're bending forward.
okay.
This is typically an 18 to 35-year-old person because they're bending over and lifting stuff and it's all coming from the back. Once you get that herniated disc, the back actually turns off the response of the hips because it needs the stability. So everything's coming from the back. So your pain comes because the disc is herniated to one side or the other.
Okay.
So you have to centralize that disc and you have to turn everything back on.
Oh, okay.
Okay?
So you kind of reprogramming to?
And
No?
we're working to get the disc back in the spot first.
Mm-hmm.
Then we're working to move the joints that typically a joint above and below have locked down
Okay.
to be able to, for around that herniated disc. So we're looking at joint restrictions, getting those moving again. Then we're looking at the hips to make sure the hips are moving properly.
Okay.
Because when you have a herniated disc, you lose that ability and everything comes from the back.
Okay.
So to get that motion back again, then you have to stabilize all that and you have to re-educate the hips to do what they're supposed to do, which is, and I'm going to go down and go into a squat like this.
Okay, so our next question is like, well, what types of exercises or what are some of the things that that you're having them do to strengthen those areas, or to, you know, like you said, as far as the hips and so forth?
Well, it's comprehensive.
Oh,
So
okay.
we have a phased system. So whatever manually we do, we have a phased exercise system that we use to refire the muscles.
Sure.
Your body starts compensating. Your hamstrings and your glute firing patterns are off. Your multifidus back here that support the spine has been turned off, and your transverse abdominis has been turned off.
Okay.
All of that with the glutes have been turned off. We've got to first activate and fire those muscles. Once those are fired, we have to fire them within movement.
Now, that's not painful, is it?
None of it's painful. There is no pain with anything that we do.